Most people think of the bathroom as a place of hygiene and routine. You go in, take care of your needs, maybe get ready for the day and move on. But for seniors, especially those over 60, the bathroom is one of the most overlooked threats to leg strength. It's not just about falls, though that is part of the problem. It's about the daily habits that take place in that small space, habits that slowly rob your legs of strength, balance, and control without you even noticing. Let me ask you this. Do you feel a little unsteady when getting off the toilet? Do you find yourself holding onto the sink or walls when standing up? Have you started using one hand to push yourself up? These are small adaptations, right? They feel harmless, but they're signals, clear, early signs that your leg muscles are no longer doing their job the way they used to. And every time you assist yourself in those moments, you're reinforcing weakness. Think about it. If your legs aren't doing the full work of lifting your body, they're losing strength, day by day, rep by rep. That's what sitting and standing are, repetitions. And if you're using your arms, walls, or furniture to do the work instead, you're not maintaining your muscles. You're outsourcing the job. Over time, the brain learns this pattern. The legs are used less. They receive fewer signals to stay strong. And just like that, you enter a cycle of decline that begins in the most mundane place, your bathroom. It's not just the toilet. Consider how you brush your teeth. Many people lean on the counter, shift all their weight to one leg, or even sit down. These postures may feel comfortable, but they train your body to avoid balance. And balance, like strength, is something that must be practiced daily, especially after 60. This video is not about shaming these habits. They're normal, common, and often done without thought. But once you understand how they affect your mobility, you can begin to change. Because the good news is this: the same habits that are weakening your legs can be reversed. With a few key changes in how you use your bathroom space, you can turn a source of decline into a source of recovery. And it starts by becoming aware. In the next few minutes, you'll discover what to stop doing, what to start doing, and how to retrain your legs without leaving the house. Let's begin. Let's focus on one of the most common, most underestimated habits: pushing yourself up from the toilet or bathroom chair, using your arms. It seems like nothing. A little help from the sink, the edge of the tub, or your knees. But here's the truth. Every time you do that, you're bypassing your leg muscles, and your body takes note. Think of your body like a budget. When you stop spending muscle energy to stand up, your body stops allocating resources to keep those muscles strong. Why maintain something you're not using? That's exactly what happens to your thighs, glutes, and calves. The gluteus muscles are especially vulnerable. These are the powerhouses that help you rise, stabilize your pelvis, and support your posture. And when they go unused, they shrink. Studies show that seniors who frequently use arm assistance for standing lose leg strength 30% faster than those who rely on their legs. But this is not just about muscles. When you don't train your legs to lift your body, your nervous system begins to adapt, and not in a good way. Your balance reflexes dull, your coordination fades, and that's when accidents happen. Not because you were careless, but because your body was no longer prepared to respond. This decline doesn't feel dramatic. That's what makes it dangerous. You don't feel weaker overnight. You simply start noticing little things, like needing more time to stand, or feeling winded after getting up, or choosing to sit instead of stand during tasks, like shaving or brushing your hair. These are early warnings, and your bathroom is often where they appear first. Here's another layer. Your legs are at their weakest when you've been sitting for a while, like after using the toilet. If the seat is low, the angle of your hips makes it even harder for your thighs to activate. So if you rely on your hands in that moment, you're skipping the hardest and most important part of the movement, the deep engagement that builds real strength. The solution isn't to avoid the toilet. It's to retrain your body to use the toilet as an opportunity for strength building. But that starts with awareness. If you've been helping yourself up for months or years, that pattern is deeply ingrained. You're not just breaking a habit, you're reawakening a muscle system that's been asleep. And in the next block, I'll show you how. Most people don't think of sitting and standing as exercise. But for seniors, these two movements are among the most important strength builders you have. Why? Because they mimic the very actions your legs were designed for, supporting your body weight, lifting you against gravity, and maintaining control during transitions. And you do them every day, multiple times, without needing any equipment. That makes them the most natural, built-in training your legs can get. The problem is, most people unconsciously modify these movements in ways that make them easier and less effective. They push off with their hands. They lean forward to create momentum. They rise quickly without control. Each of these actions removes the strain from your muscles. And without that controlled strain, your legs don't get stronger. They get weaker. Let's look at the mechanics. When you stand up from a seated position, your quadriceps, hamstrings, and glutes must coordinate together. They fire in a sequence that stabilizes your knee, propels your hips forward, and lifts your torso. It's a full-body movement that demands balance, joint alignment, and muscular effort. But when you push with your hands or swing your body forward, you bypass this coordination. You cheat the movement. And every time you do, your legs lose a little more of their power. This is especially true in low chairs, soft cushions, or deep toilet seats, places where the angle is more extreme. The lower you go, the more force your legs need to generate. That makes these moments ideal for maintaining or rebuilding strength, but only if you're doing them correctly. Now think about how often you sit and stand each day, out of bed, onto the toilet, into a chair, up from the dinner table. Each of these is a chance to practice or a chance to deteriorate. If you're aware and intentional, these repetitions become exercise. If you're unconscious and reliant on support, they become erosion. That's why bathroom habits matter so much. The small space, the repetitive actions, the routine nature, it's the perfect training ground. You don't need dumbbells or machines. You need awareness and intention. And if you start treating each sit-to-stand movement as an opportunity, slowing it down, using no hands, engaging your legs, you'll see results. Real ones, in your balance, your confidence, your ability to move freely. And in the next block, we'll break down exactly how to use your bathroom routine to rebuild your leg strength starting tonight. It's time to shift from problem to solution. Now that you understand how unconscious habits in the bathroom are weakening your legs, let's turn that space into a daily opportunity for strength. You don't need a gym. You don't even need extra time. You just need to make 3 simple changes to your current routine. Done consistently, they will retrain your muscles, reactivate your balance reflexes, and restore control in your legs. Change number 1, stand up without using your hands, every time. This is non-negotiable. Each time you rise from the toilet or a bathroom chair, plant your feet flat on the floor, engage your thigh muscles, and stand using only your legs. No pushing from your knees, no grabbing the sink. If you feel unstable, slow down, but keep trying. The first few times may be hard. That's a sign your muscles have been underused. But the more you do this, the stronger you'll feel. It's a built-in leg workout that you repeat multiple times a day. Change number 2. Brush your teeth while standing tall and balanced. No leaning on the sink. No slouching. Stand with your feet hip-width apart, knees soft but not bent, spine straight. As you brush, try shifting your weight slowly from one leg to the other. This simple change turns a passive 2-minute routine into a balance and stability drill. You're training your core, hips, and ankles, all vital to staying upright and avoiding falls. Change number 3. Add 1 controlled sit-to-stand rep before you leave. Each time you're done in the bathroom, add 1 deliberate sit and stand movement. Sit down slowly on the toilet or a safe chair, pause for 1 second, then stand back up without using your arms. This bonus repetition reinforces strength in your thighs and glutes. Over a week, that's 14 extra leg exercises. Over a month, more than 50. And those reps add up, especially for seniors. Don't underestimate these micro movements. They're exactly what your nervous system needs to stay sharp and responsive. And because they're part of a familiar routine, They're easy to remember and repeat. That's the key to progress. Consistency without complexity. You don't have to turn your bathroom into a workout zone. You just have to stop letting it be a weakness zone. These small changes will not only stop the decline, but reverse it. Your legs will start doing what they were meant to do again, hold you up, carry you forward, and keep you independent. In the next section, we'll show you how to amplify these habits for even faster results and what mistakes to avoid as your strength returns. Even with the right routine, certain mistakes can hold you back or even undo your progress. These aren't dramatic errors. They're subtle choices that most people make without realizing the cost. But if you want your legs to get stronger, not just stay where they are, you'll need to recognize and avoid these common traps. Mistake number 1, rushing through the movements. One of the biggest killers of leg strength is speed, specifically moving too fast during sit-to-stand motions. When you rush, your muscles don't fully engage. Instead, momentum does the work. That might feel easier, but it provides almost no benefit to your legs. The goal isn't to just get up, it's to get up with control. So slow it down, sit gently, pause, then stand slowly. This forces your quads, hamstrings, and glutes to do the full job. And that's where strength comes from. Controlled resistance, not quick motion. Mistake number 2, only doing it when you feel strong. Progress doesn't come from waiting for a good day. It comes from showing up even on hard days. In fact, those slightly stiff mornings, they're the most important time to train your legs. Why? Because when your body is cold or tight, it needs activation even more. Think of it like brushing your teeth. You don't skip it just because your gums feel sensitive. You stay consistent, and the result is improvement. The same rule applies to your legs. Mistake number 3, ignoring fatigue or pain signals. Strength building should feel challenging, not painful. If your knees ache during a movement or your back tightens, it's not a sign to stop everything. But it is a sign to adjust. Maybe your stance is too narrow, maybe your chair is too low. Don't push through pain. Modify until the motion is difficult but safe. Always listen to your body's warning signs. They exist to protect you, not to scare you into inaction. Mistake number 4, comparing yourself to others. Your progress is your own. Don't measure it by what another senior can or can't do. Some people regain strength faster. Others take weeks just to remove their hands from the push-up. That's normal. What matters is consistency, improvement, and the fact that you're doing the work. Every successful senior you've seen started from weakness. They just didn't quit. By removing these mistakes, your bathroom routine becomes a reliable daily tool for leg recovery. You build better habits, better awareness, and ultimately better strength. You don't need perfection, just the discipline to do the right things the right way every day. In our final section, we'll talk about what real change looks like, how to measure your progress, and why the small wins in your bathroom can create massive improvements in your life. Let's talk about results. What actually changes when you stop hurting your legs with daily habits and start using those same moments to rebuild strength. Most people expect something dramatic. A sudden burst of energy, immediate balance, or muscles that feel young again. But that's not how real progress works. It's quieter, more subtle, and far more powerful. You'll notice it the first time you stand up from the toilet without needing your hands, and it feels normal. Not forced, not shaky, just natural. That's progress. You'll catch yourself brushing your teeth without leaning on the sink, standing tall, shifting your weight with ease. That's balance coming back online. You'll realize you're taking stairs without holding the rail, or that you walked farther today than last week and didn't even notice. These are the victories that matter, not because they're flashy, but because they restore your freedom, your confidence, your independence, and all of it started in the most ordinary place in your home, your bathroom. The reason this matters so much is because leg strength isn't about fitness. It's about function. It's the difference between standing and falling, between walking into the kitchen or waiting for help, between aging with fear or aging with freedom. Your legs carry your life, and what you do with them every day defines the life you get to live. Here's what you need to remember. Nothing improves without awareness, and now you have it. You see how small habits, assisted standing, passive posture, skipping movement, were costing you strength. And you know how to fix them, with intention, with repetition, with a mindset that says, I may be aging, but I'm not giving up my legs without a fight. So what do you do next? Start today, right now. The next time you use the bathroom, make it count. Stand up slowly. Don't use your hands. Add that one extra sit to stand before you leave. Make brushing your teeth a time to train balance. Turn a passive space into a training zone. One that fits your life, one that builds your future. Because the truth is, you don't need a personal trainer. You don't need fancy machines. You don't even need motivation. You just need consistency. And your bathroom, that small, quiet room, can become the foundation of your recovery. Start small, stay strong, and remember, your legs aren't done. They're waiting for you to use them properly, purposefully, and proudly.